Okay. Good afternoon, everyone. I'm Mayor Paulette Guajardo. On Monday, the Food and Drug Administration granted full approval to the Pfizer-BioNTech coronavirus vaccine. This is a milestone achievement that I hope will encourage more people to get vaccinated. Experts say that the highly contagious Delta variant presents an unprecedented threat to those who are not vaccinated. To combat these issues, the City of Corpus Christi and Nueces County Health District will continue to provide both the Pfizer and Moderna vaccines. The vaccination, along with mask wearing, will help to save lives in our community, and I encourage all residents to do both and social distance. I want to remind everyone of the messages that we shared earlier in this pandemic, which still very much apply. Wash your hands well and often, wear a mask, and social distance. Now, as of yesterday, the Nueces County has 153,805 fully vaccinated people. The Public Health District has administered 144,127 vaccinations. So please note that medical professionals have stated that even after receiving your vaccinations, you should continue to wear your mask to protect yourself and others. This is one of the most effective ways that we can decrease the spread of the virus as a community. And if you're not vaccinated and would like to get vaccinated, there are many resources still available for you. If you are 12 years of age or older, you can go to the old Charming Charlie location right across from Grimaldi's Pizzeria at La Palmera Mall. The vaccine clinic is open every single day, Monday through Saturday from 10 a.m. to 9 p.m., and Sunday from 11 a.m. to 6 p.m. You may also come to the La Palmera Mall if you are immunocompromised and you want a third dose vaccine. Additionally, we are excited to announce that the City County Health District is opening a new vaccination site at our Greenwood Senior Center, and our Public Health Assistant Director, Luis Wilmot, will speak more about this momentarily. I want to please remind everyone that if you want a vaccination but maybe need a ride to get one, our Corpus Christi Regional Transportation Authority will provide free rides to and from the city's vaccination clinic at La Palmera Mall. And once you're on the bus, all you have to do is tell the driver that you are going to get a vaccine. And as you know, or you may have heard in the past, we have relaunched our Save Our Seniors program, and we're providing third shots to our senior citizens in the community. We've contacted over 3,000 senior citizens to inform them of the opportunity to receive their third shot, and thus far, we have scheduled about 500 of those individuals. So we want to thank our firefighters for all of their efforts in this initiative. If you're a senior or you know of someone who needs that third shot that's a senior, please call 361-826-CITY. That's 361-826-2489. So in addition to that, our in-home vaccination program is centered around bringing vaccinations directly to your doorstep. To date, we have registered over 800 residents and have administered 300 vaccinations. So if you would like an in-home vaccination, please call the city's customer call center at 826-CITY, which is 826-2489. And there have been many calls to my office inquiring about booster shots. For healthy individuals seeking a third dose, the Public Health District is preparing to begin administering boosters in late September. The CDC has recommended that healthy people who receive the Moderna and Pfizer vaccines should receive the booster 8 months after having received their last vaccine. The Johnson & Johnson booster will be released at a later date, and we will keep you informed on that front. And for clarification, the booster shot is intended as a supplement for healthy individuals, and the third shot is for those who are immunocompromised. The City of Corpus Christi and Nueces County Public Health District has provided COVID-19 testing sites for those who want to be tested. And you can visit the Old Christus Spawn Memorial Hospital Monday through Thursday from 9 a.m. to 2 p.m. And if you're experiencing mild to moderate symptoms and are COVID-19 positive, there are ways to get help so that you can avoid experiencing severe symptoms and going to the hospital. For those with mild to moderate symptoms, the monoclonal antibody infusion, also known as Regeneron, is recommended after testing positive. This treatment provides a temporary but immediate boost to the immune system, which can help reduce chances that a person will develop serious complications and require hospitalization. Nueces County was selected as one of 9 regional rapid infusion centers in Texas. Our infusion center is located at the Richard Borchard Fairgrounds in Robstown, where they can currently infuse 90 patients per day. They're open daily for infusion treatments. And if you have tested positive for COVID-19 and have mild to moderate symptoms, please contact your doctor and ask about this treatment. Referrals are required, but for those who do not have a doctor, you can call the City County Health District at area code 361-561-1101 for a free referral. So finally, I just want to urge everyone to please protect yourself and your family, your friends, by doing one simple thing, and that's getting vaccinated. We want to see our numbers go down. We have to see them go down. We can only achieve that with your help, with all of us standing together, and we must focus on getting our vaccinations. We're working very hard on making that as convenient for you as possible. So with that, we'll have a brief Spanish translation from Gabby, and then we'll hear from County Judge Barbara Canales.
El lunes pasado, la Administración de Alimentos y Medicamentos otorgó la aprobación total a la vacuna contra el coronavirus Pfizer-BioNTech. Espero que esto anime a más personas a vacunarse. El Distrito de Salud del Condado de Nueces continuará proporcionando las vacunas Pfizer y Moderna. Hasta el día de ayer, el Condado de Nueces tiene 153,805 personas completamente vacunadas. El Distrito de Salud Pública ha administrado un total de 144,127 vacunas. Incluso después de recibir sus vacunas, se le pide que continúe utilizando su cubrebocas para protegerse y proteger a los demás. Si cuenta con 12 años o más y quiere recibir la vacuna, puede acudir al Centro Comercial La Palmera. La clínica de vacunas está abierta de lunes a sábado de 10 a 9 de la noche y el domingo de 11 a 6 de la tarde. Para las personas que también cuentan con un sistema de inmunodeprimido, pueden ahí también recibir una tercera dosis para la vacuna. Si quiere usted recibir una vacuna pero no tiene transporte, puede utilizar cualquiera de los autobuses del RTA y solamente decirle al conductor que va a ir al Centro Comercial La Palmera y su viaje será gratis. También estamos proporcionando la tercera dosis de la vacuna mediante el programa SOS. Se han contactado a más de 3,000 personas de la tercera edad para informarles de esa oportunidad. Si usted quiere participar y quiere que se le administre la vacuna en su hogar y quiere participar en el programa SOS para los adultos mayores, se le pide llamar al 826-CIRI, o sea, 826-2489. Para el programa de vacunas en el hogar, para aquellas personas quienes prefieren no salir de su hogar y quieren recibir la vacuna, puede llamar al mismo número, 826-CIRI. En cuanto a las inyecciones de refuerzo, para las personas sanas que necesitan una tercera dosis, el Distrito de Salud Pública se está preparando para comenzar a administrar esas vacunas de refuerzo a finales de septiembre. Los CDC recomendaron que las personas sanas que recibieron las vacunas Moderna y Pfizer deben recibir el refuerzo 8 meses después de haber recibido la segunda vacuna. Pero para aquellas personas quienes recibieron la vacuna Johnson & Johnson, la vacuna de refuerzo se va a lanzar en un tiempo después. El Condado de Nueces también fue seleccionado como el uno de 9 lugares para la administración de los centros de infusiones en Texas. Este centro está ubicado en el Centro de Exposiciones Richard Borchard en la ciudad de Robstown. Si usted se encuentra positivo por el COVID-19 y tiene síntomas de leves a moderados, se le pide comunicarse con su médico y pregunte acerca de este tratamiento, ya que estos tratamientos solamente se pueden administrar con referencias por parte de su médico. Para más información se puede comunicar al 561-1101.
Thank you and good afternoon. Barbara Canales, Nueces County Judge. There's always so much to talk about, and I've tried to condense it for us into 5 topics that I want to cover, but I do want to say that I will be available this afternoon or tomorrow morning for additional questions if there's a topic that I did not cover. As I said, there's so many different areas to provide information on. And I'm always going to say, please go to nuecesknows.com because it's a good place to receive accurate and up-to-date information. So let's talk about those 5 areas that I have decided to focus on today. The first one is COVID case rate and hospitalizations. The second is the status of requests that we've made as a community, Nueces County to the state of Texas, what we've asked for, what resources we've received, and then I'd like to move into an update on vaccinations and vaccines, although I think you just got a very good overview from our mayor. An update on antibody therapy, I'll go into just a little more detail, and an update on county services, including the motor vehicle registration office. And when I say county services, I mean we've had some developments today at the county courthouse regarding our workforce and COVID-19, and I want to bring to you the most up-to-date information. All right, sometimes they say you save the best for last. In this case, I'm not sure I have good news anywhere. Our hospitalization rates are just downright frightening. They are above 37%, and they have been at this level for the past 2 days. They have been above 30% for the past 11 days. As I told Congressman Cloud and his office just yesterday, we are in crisis here, and we are the worst in the state as far as the increase in hospitalizations, steady for over 11 days now. We have been above that 15% mark, and that is since August 4th. And so, again, when you look at, and I've got a new tool here, so give me just a second. When you look at our graph, remember this red line represents 15%. This is our zone that we don't want to cross at any given time. But we've done it before, right? This was our first surge, our first big wave, our second big wave, and then now look at us. We have way surpassed this 30% mark. And I just pray that this will come down. This is the goal here today, is to give information on how we can reverse this trend. But you'll remember, I was just with you 7 days ago when we talked about the same chart, and we were over 30%, and now we're at 37%. Our COVID hospitalizations rates, as I said, are the worst they have ever been, and they continue to climb. I just want to review again these numbers and what they mean. The state of Texas is divided into 22 geographic areas, and these are called trauma service areas. We kind of in the business of emergency management refer to it as TSA. TSA-U is our unit area, and Nueces County is, again, not unique. We share this with all the other counties. We're merged into a region. Our hospitalization rate is computed by calculating all of the hospital bed space in the trauma service area. So it's not just Corpus Christi Medical Center or Bay or Driscoll or Christus Shoreline or Saratoga. It is everybody in our trauma service area, which is why I say it's frightening. And then we compute how much of that bed space is occupied by COVID patients. And remember, why am I always going back to this line, this graphic? Well, because last year the state of Texas basically gave us this line and said, this is the one you don't want to cross. And again, I want to point out where we are. In late June, as you know, we've looked at this before. We looked pretty darn good. And people say to me, is this an alarmist point of view? Well, why don't you think about it and let me know. We were under 2%. 2% in late June. And so in July, when we started seeing that number going up, we are certainly concerned. But when does it get bad? You know, as you know, it gets bad when you can see a true trend. That means over 7 consecutive days. And as I say, it's not bad anymore if you stay 7 days below 15%. So the number makes sense. COVID patients require a lot of care. They've got to be monitored. There's respiratory therapists and therapy that are given. And they also require more isolation to prevent infection from spreading. So 15% is not your average 15%. It's a 15% true strain on your overall healthcare system. And I just want to say that even though 15% is the bad line, I'd give anything to be back at 15%. On August 4th, we crossed that 15% line. And again, these 3 weeks above 15%, 11 days above 30%, and the last 2 days at 37% have prompted me to have as many serious conversations as I could possibly have with representatives of both the federal government and the state government. We have to drive this number down, I told them. The way we drive it down is this offense and defense. And the getting vaccinated message that your mayor just gave you is the right message. And that sounds sometimes like a defensive move, but it's really an offensive move. Vaccines will help our community, and they will help you fight this virus. But it will take time, and so there are other things that we need to do. If everybody got vaccinated tomorrow, if my wish came true on that falling star I saw last night, then it would still take time, because we have to have that. If you're taking Moderna 28 days or Pfizer 21 days, only that J&J shot's the one shot, one and done. But the rest takes time in order to receive that full immunization. And so what do I want you to really focus on today? And I know Dr. Wilmot's going to reemphasize this, so I won't belabor it, but I'm moving from 3 W's, Dr. Wilmot, to 4 W's. I'm moving from wash your hands, watch your distance, and wear a mask. And in just a minute, I'm going to talk about that 4th W, which is watch those symptoms. Think about the things that you're doing every time you go out. I'm tired of talking about mandates. Let's talk about what we can do together that you don't have to be mandated to do, and that's take care of yourself. Ask yourself, is this a crowded area? Are there too many people in close proximity? Is everybody have to go to the store at the same time? Or can't we just send one person? These are the small things that truly matter right now to drive that old curve down or this curve down. They can make a difference. And especially with the Delta variant, they can make a large impact. It's so easily transmitted, and it can so infect people quickly who are even vaccinated. The good news is that those who are infected and vaccinated often have these mild symptoms or no symptoms at all. And the bad news is that those people who feel okay can still spread the virus. So we got to play that defense. Even if you're vaccinated. It's not an excuse, even if you're vaccinated, to not keep up these practices during this time when we're like this. We need you. We need you to continue to watch your distance and wear a mask and wash your hands when you know you need to do it. I don't think I need to tell you. You know when it makes common sense. Even if you're vaccinated, it's that bad right now. So let me talk to you about resources now. And as others will tell you, and I will tell you, on my way over here, I looked at our numbers, and it's so painful to see 15 deaths in one day. It's so painful to tell people in Austin that your deaths are going up, not down, despite the fact we have vaccines and therapeutics. I'm working to get more resources in the county. That means every type of resource, more nurses, more respiratory therapists, more emergency department personnel. That means ICU and med-surg as well. More vaccinators, more residents, more nursing students, anybody who I believe fits the eligibility in the bill, we're asking to help us. I'm even tried to make, I would say, really drastic steps this Saturday. It's terrible when you tell somebody, man, you are doing a great job. We must have had at our rapid injection site more than 160 a day. And I still say to them, can we do more? When we're basically doubling what the state is doing. And I know they must think to themselves, I mean, aren't we doing enough? And of course, they're doing everything they can, but we're pushing it so that we can make certain that we have even more infusion capacity. And I want to thank public health for the brilliance that they have in reverse alerting everybody who is COVID-19 positive. If you're getting a reverse alert, it's so that you can consult with your doctor about this infusion therapy for your mild and moderate symptoms so you won't get more severely ill. And if you don't have a doctor, remember that earlier the mayor talked about the fact that you can call that COVID clinic. You can make a plan with the doctor even if you don't have a regular doctor. I want you to know that the state is listening to you, that the federal government is listening to you through our congressmen, through our state senators, through our chairmen and state representatives. Our requests have been heard and we are getting some help. But unfortunately, it's like that 167. I need more. We need more. We had to request things that I hadn't seen since a year ago, like a morgue trailer. And we just are pained by the fact that we might have to get another one after today. Our deaths due to COVID are definitely exceeding our capacity in our community for medical examiners to conduct autopsies as well as our mortuaries. So we've got to have this additional space. There's no good news in that, other than the fact that the state answered our request. That's always appreciated. And we're getting the resources that we need from the state and FEMA. But again, they are trickling in and we need sort of a free flow. But we understand that everybody is in need now. As I told everybody, we are the worst per capita right now for these hospitalizations going up. And therefore, we need you to send your new resources to us as a high priority. I also told them that I was optimistic in this way, that we had the tools to fix this. I said it last week and I thought it resonated with people, so here we go again. We have vaccines that work, so get them. They prevent people from getting infected. Those who are vaccinated and those who do get infected with the Delta variant will, on statistical average, have less severe symptoms and shorter illness. And now this Pfizer vaccine, remember the very first vaccine, the Pfizer vaccine, is fully approved by the FDA. So if you were one of those people that really believed that that FDA approval was necessary for you to be ready, now we're there. Now it's time, because that FDA fully authorized Pfizer vaccine is available to you at La Palmera Mall every day of the week. This approval, by the way, does come after millions and millions of vaccines have been administered under the emergency use authorization. The Pfizer vaccine has been deemed to be safe and effective and fully approved for those individuals 12 years and older. And again, as I said, if you were on the fence waiting for this approval, you don't need to wait any longer. You can go tonight. There's still time. Or how about tomorrow morning? We have the third dose available for the immune compromised. We call that the additional dose. These are not the booster shots. Those will be coming on September 20th. And these additional doses of vaccine are those for very special individuals who have immune systems that are compromised, and they need to get that level immunity up. And so I just want you to know that we've been focused on that, both from the city's perspective and their fire department's program on in-house vaccination, and also with the city county health department. So we're making all the preparations that you want us to make, I know, to deliver those boosters effectively and swiftly starting September 20th. We've already taken out a new lease at the outlet malls at Richard Borchard Fairgrounds. Remember that the state-run infusion centers at the fairgrounds, but the outlets across the street are available, and they're an excellent location. We also will have more details very soon on how booster shots will roll out, and we plan on bringing those to you in the coming weeks. I'm very thankful for one thing, and that's that these vaccines are here. Last year, when we had all those, spikes, we didn't have any tools. And every vaccine, every individual, I believe, helps keep that red line from going up even faster in the coming weeks ahead. And you heard about the treatments, and I don't want to belabor it, but I'm just very proud of what it is that we are accomplishing here. We are helping the state of Texas at City County Public Health at the old COVID clinic location. It's additional capacity. It's inside the city limits. And again, you do need a doctor's referral order, but if that is the problem, we have a way for you to visit with a doctor. And this antibody therapy, I think we can do up to 200 a day there. But I'll have to be honest with you, we're going to be expanding. We were just working on Monday through Friday, and I believe this weekend we're going to be doing Saturdays as well. We're going to be utilizing help from the residency program at Christi. So we're grateful to those young doctors that are coming on board to save your Nueces County neighbors. And every person treated there, I believe, and the doctors believe, are less likely to go to the hospital. They're less likely to suffer symptoms, and of course that means we're less likely to see those deaths go up. So my final news today concerns the operation of motor vehicle registration at the county courthouse. So we're like a business at the county, like everybody else, and unfortunately, due to the outbreak of COVID, we have been impacted severely today. We were impacted with several departments and a number of employees. And so the tax assessor collector did have to make the decision today to close motor vehicle registration. It will be closed until further notice. There are many ways to get your motor vehicle registration, and I would urge you to just check with our website, but there is an online process in case you need to fulfill that need. We do appreciate the patience and understanding of all of our customers at this time. It's an unprecedented wave of infection, and I'm going to encourage everyone to see if they can conduct their business using, again, our online, our mail, or our retail registration options. I'm going to give you two ideas that I think are excellent. You can do it at HEB. There are some eligibility. You can't have an expired motor vehicle registration there. You can mail it, and again, it's on our website, but for the media, it's P.O. Box 2810, Corpus Christi, Texas 78403. Or you can go online to textdmv.gov. textdmv.gov. And again, if you visited the motor vehicle registration office in the last few days and you're concerned, what I need you to do is just watch out for any symptoms. Pay close attention, such as cough, fever, or sudden loss of sense or smell. In fact, I'm going to be urging everyone in the coming days to just be attentive to their own condition. Delta moves quickly. It particularly invades the unvaccinated's lives. People infected with Delta get very sick very quickly. It appears also to infect children and those who cannot be vaccinated. And this is a absolute indicator on the public health pie charts that were revealed yesterday, how many of our new cases represent that 18 and under. So please pay attention to yourself, but don't forget your children as well. Monitor them for any symptoms. When in doubt, have it checked out. Don't delay seeking a test because you think it could be allergies. We have effective treatments, but those treatments only work in the early phases of infection. We have the tools to fight this. We have the tools since January to fight this offensively, defensively. We have the right team, as I said last week, to fight this. You're about to meet one of those team members shortly from City County Public Health. And we're here for you. We're here for all of you. We need you to do your part. And as I said, that's that 4 W's. Take your symptoms seriously. If you start experiencing them, act early. If you're not feeling well, stay home. We can help you, particularly if we catch it early. And we're going to find a place for you. I don't want you to worry about all of this bad news about 37% and whether or not it's going to just be that way forever. Even if it goes up, we're going to fight. We're going to fight like crazy to get more beds online. And we've been doing that every single day since we started this surge. And we're going to say this once again, I'll do whatever it takes to get more staff here in this community. But I'd much rather treat you for those mild to moderate symptoms And so please know that if you have the opportunity to use that infusion or injection center, we think that is a great way to help do our part community-wise to decompress those hospitals. I just feel like we've lost too many, too fast and too soon, all over again. I ask you to please do your part, and I'll be back in touch with you with more information next Wednesday or for the media anytime that you call our office. Thank you.
Nuestras hospitalizaciones continúan en aumento, más del 37% en los últimos 12 días, 37% de casos solamente por COVID. Estos niveles son los peores desde que comenzó la pandemia. Les recuerdo que los pacientes por COVID requieren de mucho cuidado, no solo de enfermeros, sino también de terapeutas respiratorios. Además, deben de estar aislados para poder evitar así contagiar a más personas. Tener el 15% de pacientes con COVID pone en aprietos a los hospitales. El 4 de agosto rebasamos ese 15%. La única manera de aminorar esos niveles es protegiéndose y actuar a la defensiva. Tome la vacuna. Las vacunas le ayudan a protegerse de una infección. Practique la buena higiene. La buena noticia es que las personas vacunadas cuentan con síntomas leves y en ocasiones no presentan ningún síntoma, pero también pueden contagiar a otras personas. Mi oficina trabaja para poder traer más recursos, más enfermeros, más doctores, más terapeutas y más personas que administran las vacunas. Sé que me han escuchado y vamos a recibir esos recursos. Desafortunadamente también tuve que pedir otra morgue móvil. Nuestro médico forense lleva a cabo autopsias para la región y las muertes debido a COVID están excediendo nuestra capacidad. La buena noticia es que me otorgaron esa morgue. Pero podemos prevenir esas muertes y eso es a través de la vacuna. Esas vacunas van a prevenir que enferme y que su condición de salud sea más corta. Ahora, con la aprobación de Pfizer, de la vacuna Pfizer, no tendrá que esperar más tiempo para recibir una vacuna aprobada y que pueda ser utilizada en mayores de 12 años. Contamos con terceras dosis para quienes tienen un sistema inmune débil y tendremos las vacunas de refuerzo para después del 20 de septiembre. Recuerde, contamos con el tratamiento de infusión monoclonal para aquellas personas quienes tienen síntomas moderados y podemos proveer con ese tratamiento hasta 200 personas en un día. Pero no son clínicas en donde cualquier persona puede entrar. Debe de contar con una referencia por parte de su médico. Finalmente, debido a un brote de casos en la oficina de vehículos motorizados en la Casa de Corte, esa oficina tuvo que cerrar la atención al público en persona. Cualquier transacción para renovación de su registro de su automóvil que necesite realizar, puede hacerlo en las tiendas H-E-B, por correo ordinario o en línea por internet. La oficina va a reabrir una vez que sea seguro el poder hacerlo.
Thank you, Gabby. Good evening. I'm Luis Wilmot, Assistant Director of Public Health for Corpus Christi, Nueces County. I'm here to give you an update on the current situation for COVID-19 in our area. It's kind of hard to follow the mayor and the judge who have already done a great job in explaining. But I'm going to go over the numbers one more time for you and give you some graphics to look at. These are not just numbers. Each one of these digits represents a life, represents a family being affected. So keep that in mind as we're going through these graphs and looking at these numbers. It's very important. Our first slide here is going to show our case count, our daily case counts. So the last 7 days, we saw 3,359 cases. The previous week, we had seen 2,840. That's an increase of 519 additional cases, new cases of COVID-19 in our area. Next slide, please. You'll see here in our graph, that entire graph, the cumulative total is 57,170 cases. Now you see over 49,000 cases have already recovered, which is great, but we have currently over 6,800 cases that are active. And unfortunately now we have a total of 977 deaths in our area. Next slide, please. Your hospitalizations have continued to tick up. I want you to take the time and think, July 1st, we had 20 people hospitalized. July 1st, that's a month and 25 days ago. August 1st, we had 165. By August 11th, we're at 328. And today, 25 days into August, we are now at 444 cases. It continues to trend up. Our next slide. This is the ICU patients, intensive care. Again, if you saw the whole graph from July 1st to now, it's a steep incline. I think July 1st, we had 7 cases. We've continued to increase today to 111 cases. Now, keep in mind also, out of those 111 cases, 85, we have a little bullet on our page here that says they're on the vent. That's a very important detail there. On the vent means that I have somebody who cannot breathe on their own. They are in the hospital, on a machine, unable to breathe on their own. They have a tube down their throat, and we're trying to keep them alive. And unfortunately, when somebody gets intubated, it's a very high percentage that they do not make it out of intubation. So 85 of our community members right now are on the vent. Again, 111 are in the ICU. That is very important, and it's important that we continue doing what we have to do to fight this virus. Next slide, please. Cumulative total of our deaths in Nueces County since the start of this pandemic, 977. I'll tell you, 112 were in the month of August alone. That's almost 11.5% of the deaths total have been in the first 25 days of August. That's an ugly number. Next slide. Today we reported 15 deaths. These people that passed away, they ranged from ages 30s all the way to 80s. Some did have comorbidities, diabetes, hypertension, obesity, COPD, chronic kidney disease. Regardless, these are 15 family members, 15 community members that are being affected in our community. You know, today sadly marks the highest single day death count for Nueces County because of COVID-19. Next slide, please. I included this slide today because I wanted to show you who it's actually affecting, what these new cases are coming from. This is the new cases of COVID for the month of August. They're broken down by age range. If you see on the top here, 12%, that's ages 0 to 9. As you go down to the right, that's 15%, that's ages 10 to 19. And then the gray area is ages 20 to 29. So from age 0 to 29, that roughly is 50% of the new cases that we're seeing. Who's unvaccinated in our area? Well, our children, especially the children under the age of 12. They're not eligible to be vaccinated. A lot of our parents are still concerned about the vaccine for our own kids. I understand that concern. We don't know the long-term effects of the vaccine. We don't know the long-term effects of COVID-19. But we do know the effects of raising a child without a parent, or a parent raising, not being able to have their child there. So this is concerning. We need to do better and get ourselves back in track of fighting this virus. So what is the public health doing? What is our response? We have broken this down into 3 different pillars, okay, or methods. These are methods to combat the virus. It's prevention, it's early detection, and now early intervention. Next slide. So prevention, we've been talking about this already every single day since we started. Get vaccinated, right? The vaccinations have already proven effective to keep the masses out of the hospital. The majority of the people in the hospital right now are unvaccinated. 95%, above 95% are unvaccinated. Same thing with the folks in ICU and our deaths. They're safe. Vaccinations are safe. We don't see people dying from being vaccinated. We have not seen that here in Nueces County at all. We are seeing people dying from COVID-19. In an effort to help that prevention, as the judge and the mayor already spoke, La Palmera Mall is open daily from during mall hours for vaccinations of all doses. First dose, second dose, the additional dose. We are not yet allowed to give boosters. We're looking forward to that in mid-September, maybe late September 20th, once it's approved by the CDC and the FDA to allow boosters. Right now, these are for folks first and second and third dose for the immunocompromised who need them. We are, as the mayor mentioned earlier, we are opening an additional site at the Greenwood Senior Center. That's at 4040 Greenwood Drive. We plan to be open there Monday through Friday from 12 p.m. to 7 p.m. The whole intent is to try to help you guys that are working still, that maybe can't get off work in time. We have additional hours available at that site. We're also going to be open from Saturday, 10 a.m. to 5 p.m. This area, this site, Greenwood Senior Center, will start on Monday, August 30th. Another part of prevention, we're going to continue to tell you, please wear your mask. Please social distance. Please wash your hands. Please wipe down commonly used areas just like we're doing this here in between speakers. That is our best way to prevent the spread of this virus. Next slide. So, early detection. We need to test you. And the Public Health District is offering ample opportunities to get tested, as well as there are third-party testers out there as well. Take advantage of those. But we're doing drive-through testings at the Old Memorial Hospital in the parking lot, Monday through Thursday from 9 a.m. to 2 p.m. There's online registration available at www.cctexas.com. You can register on site. However, that might pose a longer wait in line. I'll tell you based on the samples that we're collecting out there, we're averaging about a 40% positivity rate. We're seeing sick people there. 40% are coming up positive in the people that we are testing. All our positives, there are too many on a daily basis. I cannot have a phone bank person call each and every person. We're trying to get them alerted as soon as possible. So what we are doing now is sending them a reverse alert message saying the person who registered with this phone number is positive. Now, there is one little issue to that. If you're a family of 4 and you and your spouse decide to use the same phone number as well as your kids' numbers, you're going to get 4 text messages. 4 text messages that might be off. One that might say you're negative, one that might say you're positive. Feel free to call us here at the Public Health District at the 826-7200, and we'll let you know which one of y'all is positives. Better yet, if you could use a different phone number for each person, that would be ideal. But that's the fastest way we can get you informed about your results and get you the care that you need. The last slide we had here was about our early interventions. So let's be clear, there is no cure for COVID-19. Our providers, their treatment in the hospitals is all anecdotal. We are throwing everything but the kitchen sink at this virus. They're using antiparasitics, antivirals, antibiotics, anticoagulants. They're trying to save lives, and they're doing these things. There's a new tool that we have in our chests, and it's called a monoclonal infusion, monoclonal antibody infusion. The maker is called Regeneron. The specific drug is called RegenCov. It's a combination of 2 different drugs, and it has been granted emergency use authorization by the FDA. It is approved for individuals ages 12 and older who are at least 88 pounds. This is a treatment for mild to moderate COVID symptoms. This is not for the severely sick that are already hospitalized. If you require oxygen, it's too late to get this medication. If you require hospitalization, it is too late to get this medication. As a matter of fact, it may even cause worsening of symptoms. So it's important that we jump on this sooner rather than later. The preliminary studies are showing that we are reducing hospitalizations by 70% in the people that we have treated with this. You must meet eligibility criteria. Again, not everybody is a candidate for this particular injection. If you come in difficulty breathing with a pulse oxygenation level of less than 94%, we cannot treat you with this. We're going to send you to the ER. It's that crucial. The symptoms that you have should have been within 10 days of onset. 10 days or below is when we can actually treat you with this particular therapy. If you're past those days, this therapy is no longer for you. There are other criteria to take into effect. I've spoken to you already about the pulse oxygenation level greater than 93. If you are pregnant and positive with COVID, we ask that you have your OBGYN provider say it's okay for you to get it. You must not be on oxygen, and you must be stable to be treated at home. And we want you to have a positive COVID test. There is also indication for post-prophylaxis, meaning if you are highly or immunocompromised and unable to fight the virus on your own, and we think that you are now in peril if you're not going to be able to mount a good defense, there is post-prophylactic exposure. A lot to consider there. Here's the bottom line. So if you do not have a provider and you don't know where to get a referral, we have a phone number for you to call. Our number is 561-1101. Our phone bank stands ready. It's open Monday to Friday from 8 to 5. These folks there, under the local health authorities rule, we are actually going to review your symptoms, check you for eligibility criteria, and we're going to get you in to the next available slot at the infusion centers. We are referring to both infusion centers, the one in Robstown and also the one that we have stood up here in front of the Old Memorial Hospital. Call that number, 561-1101. If you're positive and you want to be evaluated for this treatment, we'll be happy to help you out and see where we can get you to be taken care of. That concludes my report. I'm going to be followed by Dr. Christopher Bird in his video, pending Gabby's translation.
El día de hoy se reportan 6.864 casos activos, un total de 977 fallecimientos. El día de hoy son 15 esos fallecimientos. Tan solo en el mes de agosto se han reportado 112 fallecimientos. Los casos durante el mes de agosto, el 20% de casos son de edades de personas de entre 20 a 29 años, seguido por el 17% de edades entre 30 a 39 años. Las recomendaciones para la prevención del contagio continúan siendo las mismas. Vacúnese. Las vacunas son efectivas y evita que más personas lleguen al hospital. Las vacunas son seguras. Los fallecimientos se deben al virus y no a las vacunas. El Departamento de Salud Pública está ofreciendo vacunas en el Centro Comercial La Palmera con el mismo horario del centro comercial. Y también se estará ofreciendo un segundo lugar, una segunda clínica en el Centro para Adultos Mayores de Greenwood, ubicado en el 4040 de Greenwood Drive. Este va a abrir el 30 de agosto y el horario de servicio va a ser del mediodía a las 7 de la noche, de lunes a viernes, y los sábados de 10 de la mañana a 5 de la tarde. Pero recuerde, este va a abrir el 30 de agosto. Se le pide que continúe utilizando su cubrebocas, practique distanciamiento social, practique buenas normas sanitarias y sobre todo desinfecte áreas utilizadas con frecuencia. El Departamento de Salud continúa ofreciendo pruebas de detección del virus en el antiguo Hospital Memorial de lunes a jueves de 9 de la mañana a 2 de la tarde. Se puede registrar en www.cctexas.com o en el mismo lugar, ubicado en el 2606 de Hospital Boulevard. Desafortunadamente, el porcentaje de casos positivos es de hasta el 40%. Las personas que resultan positivas del virus se les notifica mediante un mensaje de texto con opciones para su tratamiento. Para más información puede llamar al Departamento de Salud al 826-7200. Aún no existe cura contra el virus, pero sí existen tratamientos como el Regencov, que ha sido aprobado de emergencia por la FDA. Algunas personas pueden obtener el tratamiento, pero deben de ser mayores de 12 años, tienen que pesar al menos 88 libras, contar con síntomas de medios a moderados. Estudios preliminares han indicado que ese tratamiento reduce las hospitalizaciones hasta en un 70%. Solo las personas con los requisitos pueden obtener ese tratamiento. Si usted no cuenta con un médico y quiere ser evaluado, se le pide llamar al 561-1101.
Good afternoon. My name is Dr. Chris Bird, and I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. And I'm here to deliver this week's Texas Coastal Bend COVID-19 Pandemic Report. Our objectives on the modeling team are twofold. The first is to address your concerns and questions about COVID-19, and the second is to enable evidence-based decision-making on behalf of our local leaders. I want to start off a little bit differently this week than in the past because we've broken some records in the past week, and these aren't records that we want to be breaking. So the first one is 3,683, and that is the most confirmed COVID cases in a one-week period that we've experienced in the Coastal Bend. That's occurred in the past week, and the previous high was 2,917 on July 16th, 2020. So we're at about 27% higher than that previous number right now. Hopefully this doesn't go much higher. And the second number is 526. And this is the most COVID inpatients that we've had in 2021 in our hospitals. The all-time high was only two higher at 528 on July 22nd of 2020. I want to point out that these numbers are linked to each other in that in July of 2020, the high number of COVID cases came 1 week before the high number of hospitalizations. So once we're pretty sure that we've peaked, we can expect that the hospitalizations will peak about 1 week after the cases. Now let's look at these cases, and there is some evidence that we might be nearing a peak or at a peak in 20 to 39-year-olds, 40 to 59-year-olds, and 60-plus-year-olds. All look like they're approaching a peak in the number of cases per day. And this is in Nueces County. However, if you look at the 0 to 19-year-olds, we don't see this same trend right now. It's continuing to increase. And unfortunately, this is our young and vulnerable community. Younger people in the coastal bend can't be vaccinated if you're below 12 years old. COVID seems to be, and the Delta variant especially, seems to be running through this population more than it has in the past. The other thing to take note of here is that there are many, many, many more of the cases of COVID in not vaccinated people, people that have not been vaccinated, versus those that have received at least one dose, if not 2 doses, if it was a messenger RNA vaccine like Pfizer or Moderna. And you can see there's just a lot fewer cases in that case. So overall, the majority of cases are unvaccinated. And we have more cases in the 0 to 19-year-old age group than in other ages, and we've never really seen this before. You can look back to the winter where the 0 to 19-year-old age group made up the fewest cases. Now we have the opposite situation. Next, we're going to look at the percentage of hospital capacity that's devoted to COVID patients. Right now we're at 37%. That is unfortunately also an all-time high for us in the coastal bend. This is also the highest value in Texas presently. Of all the trauma service areas, the coastal bend trauma service area has more of its staffed beds filled with COVID patients than any other trauma service area. And one of the reasons why we show this statistic is because it was a major metric that was used in the past to determine whether local governments could implement new mitigation measures. Now, that's not the case anymore, but just for comparison's sake, we only got to 15% once in the winter, and we've been well past 15%. We're at more than double that right now at 37% for more than 2 weeks. And our hospital vacancy is down. It's down much lower than we've ever seen before. On average, through the winter, we've had an average number of available beds in the hospitals at about 30 to 40%, depending on what time period you pick. But recently, this number has really dropped off. And part of the reason for this is the amount of staffing that's available for our hospitals has decreased over the past month by quite a bit. And the other reason why this is dropping is because the number of COVID patients has increased to almost the highest levels we've ever seen. So this is the lowest we've observed during the pandemic, just below 10%, about 8 or 9% of the beds in the hospital are available. And this is not a good low number. We want this number to be much higher, maybe more in this 30 to 40% range. So let's see what's going to happen here. So we're going to use our TAMU-CC model of the pandemic to look at 2 scenarios. The first scenario is what will happen if we maintain our present level of vigilance. We don't back off on our mitigations of COVID-19, but we don't increase them either and let COVID burn out given that present level of vigilance. That would be represented here on the transmission rate graph by this red line. Remember, transmission rate is the number of people that get infected from somebody else who got infected. So right now the transmission rate is 1.1. What that means is that for every 100 people that get COVID, they're passing it on to 110 people. That 100 people infects an additional 1.1 people on average, or 110 people overall. And so we're close to 1, but not quite there. And 1 is so important because this is the dividing line between accelerating and decelerating. And so COVID really can't do anything but accelerate or decelerate. You can think of it as a New York taxi cab driver. They're either on the gas or on the brakes. They're either speeding up or slowing down, and that's the way COVID works. So even though 1.1 sounds low, and it's close to 1, it means accelerating. Not until it goes below 1 does it mean decelerating. Okay, so we covered our first scenario. Now let's talk about the second scenario, which is more optimistic. And under this scenario, we assume that more interventions have been taking place, more masking. We're doing more to stop the transmission of COVID-19. And so what we do to simulate that is we set this transmission rate to a little bit below 1, which is well within the bounds of what we see in the past in the coastal bend. And we do that about a week ago on August 17th. And the reason why we do it a week ago is because there's a delay between when you get infected, which is what the transmission rate is looking at. It's looking at infections, and when you test positive. And so when we're looking at positive cases today and we're estimating the transmission rate, we're really estimating it for about a week ago. So these are our two scenarios, and let's see how they play out. And for what it's worth, these are the same two scenarios that we've been running for the past couple weeks. So in the number of census ICU patients, if we maintain the present level of vigilance, it looks like we're predicting a peak of 214 ICU patients, or at least 214 people requiring intensive care on September 23rd. Or if we change our behavior and slow down COVID, it looks like we could peak at a lower number, closer to 152. Maybe we could even stay below that summer 2020 peak that we saw last July. And that peak would be predicted to be sooner on September 8th. So these are kind of the ranges of reasonable outcomes that we could expect to see. And this maintained present level of vigilance scenario leads to 1.4 times more ICU patients than in the past peak in July 2020 at that present rate. Okay, moving on to inpatients. This includes ICU patients as well as general admissions. And again, if we maintain the present level of vigilance, we're looking at about 717 inpatients on September 16th, or if we change our behavior and slow down COVID, we're looking at 515 inpatients on September 1st. Now, you'll notice that there is a difference here between the observed number of COVID inpatients, which is here in black, which, as I said earlier, is already at 516, just a little bit higher than the predicted peak here. But there is variability. If you look in the past, you don't get exact numbers all the time in terms of the actual number of people in the hospital versus projections. You can see quite a bit of variation over here last July. You can see variation here last winter, and that could be what's happening here. But so this is the range of possibilities that we're looking at, as long as we don't let off. If we let off, then these peaks could be higher. So again, 1.4 times more hospital patients than we saw in July 2020 is what's projected if we continue at the present rate. Lastly, moving on to cases, and so each black point here is the actual number of confirmed cases in the whole coastal bend each day. And you can see we've already had one remarkably high day of over 800 confirmed cases, and more recently hovering in this 600 range. Some cases as low as below 200, but this is going to be a Sunday when you see those low numbers. The Sunday numbers always very low. On average, the lines up to present mark the average rise in the number of COVID cases, and then we have our two scenarios, which one has a peak about a week into the future, maybe a week and a half, and the other one, if we changed our behavior about a week ago, we could look forward to being at the peak right now. And it looks like, at least in 3 of the 4 age groups that we're looking at, it does look like there is an indication that peaking in the number of cases is occurring. But we're not seeing that yet in the 0 to 19-year-olds. So we're going to have to stay tuned and see what happens with that. Now, what happens if you test positive right now in the coastal bend? What can you do? Especially, let's say that you're not vaccinated and you test positive. What are the things that you can do to help to improve your medical outcomes? Well, there are 2 free monoclonal antibody test sites that have been set up here in the coastal bend. One is at the Richard Borchard Fairgrounds in Exhibit Hall A. We've got it marked out on the map here. I think everybody knows where the fairgrounds are. And the second site is right in the middle of Corpus Christi at the Physicians Plaza West site. To be eligible for the free monoclonal antibodies, you have to either test positive for COVID-19 and have proof of that, or get a referral from your doctor. And again, the reason why you'd want to do this is to decrease the severity of COVID and decrease your chances of being hospitalized. Excuse me. This is the same treatment that former President Donald Trump received when he contracted COVID. Okay, so in summary, the new cases are showing signs of peaking, but not across all age groups. And I urge caution because sometimes the way that we're fitting these lines, they can look like they're peaking, then we get another day of data, and then it doesn't look like they're peaking again. But this is the first time we've seen this in several weeks, so that's a good sign at the very least that we might be close to a peak. Secondly, hospitalizations are still skyrocketing, and this is not a good sign. Once we have our cases peak, we can expect that the hospitalizations will likely peak about a week later. So recommendations to avoid a public health disaster here is if you're symptomatic, self-isolate and get tested. If you test positive, get the monoclonal antibodies. It's free at those two sites, either the Borchard Fairgrounds or Physicians West. The other things we can do if, say, we're not symptomatic is change your behavior. Think about what you were doing last week and try to do a little bit more this week to stop the spread of COVID. Mask up if you're going out in public, social distance, and get vaccinated. If you do these things, that can help us to avoid the worst case scenarios that are possible here, given how much of our population is still susceptible to COVID-19 and especially this Delta variant. I want to thank you all for listening today, and we'll see you next week.
Última semana con 3.683 casos, mientras que el 16 de julio del 2020 esa cifra era de tan solo 2.917. Asimismo, el número de hospitalizaciones ha llegado a cifra récord. La mayoría de los casos positivos es personas que no han sido vacunadas y los casos de personas entre 0 a 19 años van en aumento. El porcentaje de pacientes hospitalizados con COVID es del 37%. Los hospitales no cuentan con camas disponibles para pacientes adicionales. Actualmente el radio de transmisión es de 1.1 personas, o sea, si 100 personas están enfermas, pueden contagiar a 110 personas más. Si los residentes no toman medidas de precaución, ese nivel va a continuar en aumento. Pero si continúan tomando medidas de precaución, el radio de transmisión va a declinar. El nivel actual se estima que el número de casos aumenta a 1.4 veces más. En resumen, los casos nuevos muestran señales de que van a llegar a la cima. Las hospitalizaciones van en aumento desmesurado. Las recomendaciones continúan siendo las mismas. Utilice un cubrebocas, practique distanciamiento social y sobre todo lave sus manos. Si resulta positivo, busque tratamiento lo más pronto posible. Si es asintomático, evite contagiar a más personas y sobre todo se le pide que tome la vacuna.
Any questions? All right. Have a good night.